Thank you all for joining us. Professor Haahtela, I'm going to kick off with you because what Kathy was talking about was she was talking about some of the research and the evidence that you have personally worked on the biodiversity hypothesis. When you've taken the work that you've done in this, particularly in relation to allergies and autoimmune diseases, what is the conclusion that you have drawn and the programs you're putting together in Finland from understanding this biodiversity hypothesis?
Well, first, thank you very much for this invitation. It's an honor and a real pleasure to discuss with you here. Well, let's first talk about money. When we understood that this biodiversity issue is important for human health, and that was a collaboration with medical professionals, ecologists, and microbiologists. And when we understood that it should be implemented also nationwide, we started the so-called allergy program in Finland. It was a nationwide allergy program, 10 years. And we turned around the paradigm of avoidance and being afraid of everything. We turned that to immune tolerance. And what happened? The results were just amazing. And now only money. The cumulative saving over the 10 years' time in Finland with a population of 5.5 million. And the costs are 1.3 to 1.5 billion. So the cumulative savings, they were 1.2 billion euros. And the investment to the education of the healthcare professionals and the information campaign to the lay public, the costs were 2 million. So with 2 million, we earned 1.2 billion.
Case closed.
And case closed, we turned around totally the avoidance to immune tolerance. Because we had this basic knowledge what is happening. And I must say here that human body is an ecosystem. And that is interconnected to the wider ecosystems.
And how do you take that fundamental learning and that economic proof point? Because I think economic proof points is what everybody wants to understand and is vital, I guess, in the current economic system. That's what we need to prove to everybody. How do you take that and then mobilize, and you mentioned it there, the different parties that need to be involved that have never had to talk to before, policymakers, scientists, ecologists, educators, businesses. How do you get everybody thinking the same way?
No, well, of course, Finns never agree on anything. But nevertheless, because it was a very clear-cut educational process, we were able to convince, especially the healthcare professionals, and also what was very important, that we took the patient organizations with us from the very beginning. So the grassroots patients, their families, and the patient organizations, and then the professionals, and the whole thing turned around. And we were as amazed as you are now. And I must say that United Nations is predicting that in 10 years about 70% of the human population will be living in cities. So it's a real challenge. And we are not going back to nature. But what we can do is to take the natural elements back to our everyday living and environment. And I think it was a fantastic presentation by Catherine showing just like that, this fact is true. And also, we do not need to be months and years there our hands in the soil. It even may be enough to be 2-3 times per week in a green environment and maybe grow something with yourself and so forth. Relatively small things. Thank you very much.
No, thank you. Well, look, we'll come back and talk a little bit as well about potential of living labs and what you're doing in Lahti. Debbie, if we could bring you in as well, because you're taking these ideas into everyday healthcare, some of these ideas here in the UK. You've been a GP and you're now at Bristol University where you're looking at medical practitioner. But you're bringing nature into patient care through green social prescribing, particularly for mental health. Just give us a very quick snapshot of your own experiences and what you have learned within that sphere.
Yes, so this is something we've been doing now for about 3 or 4 years, and I have to say that the project we're doing was actually the brainchild of His Royal Highness the Prince of Wales when he was Prince of Wales, and he has this way of waking up one morning and thinking, I think we should do this. And then he'll contact somebody like Michael Dixon, who's now the head of the medical royal household, and Michael will ring me up and say, do you know what? I think we should do this. And you can't say no. So this idea was a twinning project between general practices and farms. The idea being that there was a disconnect between the doctors, the nurses, or the healthcare professionals in the practice, the patients in the practice, and their environment, particularly their farming environment. The lack of knowledge about what farmers do, where farms are, what happens on a farm, whether it's a dairy farm, a beef farm, or a farm which is producing vegetables, arable, and so on. And so we set up a project which involved myself, the Sustainable Food Trust, and the College of Medicine. And we identified a couple of farms who we felt were offering a good experience. They were regenerative organic farms, and who were prepared to invite and host patients, mainly with mental health problems, but I would say people with chronic health problems, not just mental health problems, to visit farms. The project, and if we're looking here at where and how much, these people went for 2 hours a week. They went 6 times on a weekly basis, and they got involved in the life of the farm, whatever was going on that particular day. There may have been calves being born, there may have been tomato plants needing to be removed from the polytunnels, all sorts of things that were going on. This was a very heterogeneous group of people. We didn't have any exclusion criteria really at all. People were coming together in an environment which was foreign to them, with people who they had never met before. The farmers hadn't done this before either, so there was a lot of education going on. But it worked. And this afternoon, while I'm sitting here, my patients in Stroud are at somewhere called Good Small Farms, and they are harvesting the lemon verbena, and that lemon verbena is going to be dried and used. And those are the sorts of small projects that go on each week in the farms where we are taking our patients.
And you're seeing the medical benefit of the interaction, and at the same time the farms are also earning. So DEFRA is paying the farms to start acting as part of the healthcare system.
So there is definitely a benefit. We have done quite a bit of evaluation, both quantitative and qualitative. There are people who perhaps really haven't been out of their house for a very long time. They manage to come in the taxi. And I've seen people write on the final evaluation forms, this has helped me more than anything else that anyone has offered me. And yes, we can find that there are funds available. Luckily, we have had some philanthropic donations, which has been helpful, but quite a few of the farms are part of some of the DEFRA schemes, and they can take people onto the farm and be paid for those 2-hour visits.
Which is a sort of a wonderful example of starting to combine the systems. You've also done a PhD with Michael Dixon, funded by Nielsen's, looking at reducing antibiotic use in dairy herds. Does that sort of start to show that human, animal, environmental health are all connected in your mind? Are we starting now to demonstrate that?
I mean, One Health is a big thing in universities, in medical schools. We have a medical faculty, a dental faculty, and a vet faculty. Antibiotic use is very worrying. Antibiotic resistance is even more worrying. And thinking that too many antibiotics in the food chain for humans is very bad. There is a lot of discussion as to whether or not we should be using that many antibiotics. the work we did was in dairy farms. And there is a bit of a fight, if you like, that goes on between the Royal Veterinary College, I hope there are no vets in the room, in this country, and farmers and the vets themselves, as to whether or not complementary approaches are appropriate for animals. Could we be doing them harm by not offering them more conventional medicine like antibiotics? I think the message that we got in doing that piece of work was that the farmers care hugely about their cows, just like I hope all our doctors care hugely about their patients. And, you know, first do no harm was actually what was being seen on all these farms. But the use of complementary, and I say that quite specifically as opposed to alternative, which can mean something very different, is absolutely the way to go for so many of the things that we and our animals suffer from.
Massimo, let's bring you in on that, because that connection between antibiotics in the system and complementary medicines really goes to the heart of what you're doing at Aboca, where you're integrating biodiversity, regenerative farming and healthcare. And the idea of systems medicine differs from traditional farming. And talk us through the two elements of what Aboca does, because there's the plant-based therapeutics for the human body, but also the impact of what that puts back into the ecosystem. It doesn't put antibiotics back.
Yes. So first of all, thank you for inviting me. That's a very interesting occasion, I think, to reflect on this relationship between nature and human health from different perspectives. What we do, as you said, we start from growing medicinal plants, then we transform them into therapeutical products to treat, and we are mainly specialized on respiratory tract, and gastrointestinal tract, and metabolism. But maybe the contribution I would like to bring today is just to contribute to this, new way of thinking. It's just to explain what is the starting point of the work we do. I mean, the man and animals have been using medicinal plants for centuries. We have a small exhibition here of also part of our museum that tell us that for centuries and centuries we have been using medicinal plants. But the point is, why medicinal plants and nature-based solutions for health can be of some advantages compared to drugs and for the human and animals. And here is the point of the interconnection between man and nature. If we have the same language of nature, which is what we have been saying up to now, then if we can discover this language, we can find in nature solution for our health that could respect our organism, and we will see also the environment. Why we say that, and we are back to One Health? Because when we have 100% natural products, we have products that are 100% biodegradable. And this is already an advantage for the respect of the environment. But then the second, the most important point, is that if we look at plants, we see complex systems. Because in a plant, you don't have only one molecule. I mean, I'm not against drug, that has to be clear. We need drug, we need chemicals, but maybe now we have the techniques to understand the natural intelligence which is already in these complex systems. I don't know if you understand me. Also, our organism is a complex system. So if we are able to understand the interface between these two complex systems, then we can use, on the base of scientific proven, on the evidence-based approach, those complex systems, which is not easy, because you have to characterize the system, you have to standardize it, then you have to understand the mechanism of action, which is not linear. It's a multifactorial one. But today, thanks to system biology and looking at system medicine, using transcriptomic, for example, we can understand what are the metabolic pathways that are activated by this complex system. Then we can go and validate it through clinical studies, and also in this case, multifactorial clinical studies, where, for example, of course, you look also at the microbiota, the Catherine lesson was fantastic, telling us that we are really interconnected. And then you can also validate from an environmental point of view through a biodegradation study. So this is the point, looking at plants, looking at nature-based therapeuticals, not just as the past, not just as the tradition. I mean, we start from there, but thanks to the technology, we can find in nature solution for the future.
It's understanding the complexity and the relationships between the medicines and the body instead of one compound for one particular disease. Can I just say, all the plants used for your medicines, you grow organically. And so if we are to, what are the barriers to scaling up? How do we scale up plant-based medicine? Bearing in mind actually that your natural resource has to be grown. I mean, in a way, you need farms and farmers growing plants for medicine.
Yeah, but I mean, that's a good question. It's the question that many times they are asking me. You know, is this just a small niche model or can be scaled up? I believe it could, of course, because if not, we will not do that. I mean, we have been working on that for 45 years. Today, we see the opportunity, and in terms of the fact that you have to grow the plant, I don't think it's a problem because we have a lot of land. The problem is that we use it in the wrong way, just to make, you know, the wrong supply chain, you know, for farming and whatever.
There's an opportunity for farmers to go up the value chain here and get into
but
healthcare.
you know, the point is that we use milligrams of plants and extract. So it's not a problem of finding the land, it's the problem of putting together a supply chain processes, which is new and different. This is something new, but I believe we need something new if we want to reframe, you know, our approach to the world. And in this case, of course, everything is linked. I mean, from organic crops up to obtaining the plant, making the products without chemicals, because we are talking about circular bioeconomy alliance. So we have to look at all the aspects. And what I want to say as a very important, I think, as a very important message in this place is that the first thing we have to change is the way of thinking, because in order to understand nature, and that already was part of the discussion, we need a systemic approach, a systemic thinking. And it's the same approach we have had to develop to understand nature. So this is the real point for scaling up this model.
Let's come on to you on that point, systemic thinking, which is something that you're now working on and expanding on in Finland.
Yeah, well, we should understand that we are speaking about the climate change and we are speaking about nature loss. And the nature loss is not only taking place in the wider nature, it's taking place also in us, in our bodies. And when we think about different risk factors of diseases which you are familiar with, whether it's diabetes or obesity or asthma or cancer, or whether it's smoking, whether it's cholesterol or increased blood pressure or air pollution, they are all risk factors and nothing wrong with that thinking. But it forgets the reverse side of the coin, the protective factors. And when we speak about this health crisis of this urbanized world, we are more speaking about losing protective factors than the risk factors. It's more important to understand that we have to get these protective factors back. And that's what you are getting back. That's what you are getting back, taking the students in the farm and you are producing the plants. And this is extremely important to understand.
Which suggests actually that from private medical insurance, there's an opportunity if we could prescribe nature as part of a prevention program, that actually there may be some connection between medical insurance saying, well, if I know you're on some sort of nature prevention, then I might be able to reduce premiums. But we need to start linking, you know, outcomes into our current economic system.
Yeah, what we are doing also in Finland, we are speaking about nature deficiency or nature deficit disorder. And you can diagnose that. You can measure the so-called short-chain fatty acids in serum or in stool. These biomarkers, they need validation. But it is coming to the doctor's office. If we find this kind of a chronic diseases, we discuss with the patient, maybe you are not having an iron deficiency or vitamin deficiency or hormonal deficiency. Maybe you are having a nature deficiency. And we can diagnose that. And then we can make a nature prescription. And what we are doing is, in Finland, in the city of Lahti, it was the EU Green Capital 2022-21, we started a local program where we interconnected the public health goals as indicator diseases, diabetes, depression, and obesity and asthma, and then the environmental goals, mitigation of the climate change, the carbon footprint, and stopping the nature loss. Stopping the nature loss in wider nature, stopping the nature loss in citizens of the city of Lahti. So it all come together.
So let's take that program in Lahti, David. I'm going to ask you the hard question, and also then Massimo to finish, is as we start to understand, we see the efficacy, we see the programs, we see the research, we see what's now happening in Lahti. How do we take that, start of that knowledge, and then turn it to something like the NHS? So in this country, 50% of our national budget goes on healthcare and then welfare. How do we start taking this and actually getting the system to understand nature prescription and start saying, well, actually, it's worth us spending money and investment. If you were going to go to NICE, who decide what medicines they're going to spend in, how do we get them to start adopting this? What's the process?
Professor Willis alluded to the issues, really. I mean, it's research to some extent, it's money to a large extent, and it's persuading NHS England, the Treasury, that there is a real cost benefit because there will need to be upfront investment. The way we've managed to run our project is through the social prescribing platform. We have social prescribing link workers, they work in primary care, they take the referrals from the doctors or the nurses, and then they look at what might be available for patients in their patch, and quite a lot of them will say, actually, I think farms, green social prescribing would be good for you. It's not an expensive thing to provide, but there is no more money in the kitty, so something has to give. What we then have to show is that we can save money because the patients will not be having so many outpatient appointments, they won't be having so many GP appointments, they won't be taking so many drugs. I unfortunately don't believe that that evidence base is quite there yet in order to persuade NHS England and the Treasury that this is something they should invest in. What I do think, though, is that there are, thankfully, lots of voluntary organisations, lots of philanthropists who are prepared to give it a go and to help us provide that evidence base. And that's where we're going, that's where we're heading.
Massimo, very quickly, can we, last point for you, can we get the medical industry, pharmaceuticals that have produced synthetics, to adopt the sort of industry that you're talking about?
I think this is a kind of a new frontier for the future. It's kind of talking about biotech with the real natural substances. So I would say this is something that would come. We already cooperate with some big pharma. There is a big interest, I think, in those kind of solutions because also from their point of view, they are required to find, new substances with a different benefit-risk ratio. And then we need to strengthen those cooperation. In the meantime, invest in research because we are just at the beginning of a journey, and work also from a regulatory point of view to allow those new substances, which are new, but it's new in the pharmacological context, to be scientifically proven and registered and proved.
Massimo, thank you so much. A round of applause for our panel.
Thank you.